This is to reinforce the contact for optimal traction to the occipito-atlantal and atlanto-axial joints. And I'm quite sure I've covered this in a separate section on the upper cervical spine, but I just want to reinforce it because it's very valuable information. I recall in school being taught to pull on the occiput with a posterior contact to emphasize the upper cervical, and of course when getting to mid and lower, getting degrees of cervical flexion to emphasize those aspects. However, using traction on the occiput emphasizes the posterior aspect of the occipito-atlantal and atlanto-axial joints, whereas a straight directional pull emphasizes the anterior and the posterior aspects of that joint. And because those joints are right under the pinna of the ear, whereas the mid and lower cervical joints are below that, then a contact here with a little bit of a zygomatic contact, but primary temporoparietal is what is ideal. And I like to maximize purchase with all of my fingers, and thumb on the thumb can rest on the forehead. And then I just do a very gentle traction, just match the body. It's probably less than 10 pounds of force. Realize some of the weight of the head is being borne on the table, and so if the average head weighs 10 to 15 pounds, you're still going to use less force even though you're dragging it on that surface. So I hope that's correct in terms of laws of physics. But what I find is just a very mild amount of force is all that's needed, because please understand, we're just tractioning the first two joints. So once again, the contact is here, and you'll find a different response than when you use a posterior contact. And I think you'll find this to be much more rewarding. I think your clients will as well. And I want to emphasize the duration. And you must know by now that I'm very biased towards using at least a minimum of 2 minutes, and sometimes even longer. And that's my spin on upper cervical traction. Thank you very much.